Health Minister Dr. Zweli Mkhize was expected to inspect vaccination sites in the Free State province today. That province currently in the COVID-19 third wave. But now that Mkhize is on special leave, the Free State Health MEC is conducting those inspections. And following that process is my colleague, eNCA reporter Heidi Jokos, who's in Bloemfontein. Heidi, good afternoon. Welcome to the Midday View. The vaccination where you are in Bloem just opened. And of course, it's the registration for the elderly. I'm looking behind you. I see quite a sizable presence of the senior citizens. Is it going well?
Yes, most certainly, given the fact that this is the first day of this vaccination site that is opened up here in Bloemfontein. We do know that there are about over 30 vaccination sites overall in the Free State, and the MEC here for health in the province saying that they are expecting to open up more vaccination sites as soon as the Johnson & Johnson vaccine is released from the Eastern Cape. Many vaccination sites were ready to handle the Johnson & Johnson vaccine, but given the fact that that is not happening, they had to readjust some of their vaccination sites. But as you rightfully say, the turnout has been extremely overwhelming here at this vaccination site, where you see the elderly keen to come and get their vaccine. We, of course, did speak to some of them who indicated they had been waiting for a closer vaccination site to open up here, where they would be able to get easier access to it and so forth. But the MEC is saying that overall they are satisfied with the vaccine rollout in the province. Of course, initially things were a lot slower when the vaccine rollout started for phase 2, but they're satisfied with the progress. Let's listen to the MEC for Health in the Free State.
So far it has progressed very well. I think we are doing very well. We started a bit slow because we opened sites, but not all of them when we started. And it was at the time when we started rolling out, when we employed the vaccinators and even trained them. Now we've got the vaccinators trained, we've got them on post now, and we really we have done a lot of work, and we think we are moving, and we are getting as many vaccines as possible. In the beginning, we were giving lesser vaccines because we didn't have a lot of people that were registered on EVDS. Now, more than 100 people, now more than 100,000 people have registered on the EVDS, and we are vaccinating them across the country now. I mean, across the province now. We have now opened 34 vaccine sites, and all of them have got more than 5 vaccination stations.
That's the Health MEC there in the Free State, Metsi. She used to be a nurse, by the way, Heidi. And what about the elderly, those who can't register or don't have the means?
Yes, certainly. I do know that she used to be a nurse because she actually gave me a pep talk before the interview about how I need to be extremely careful now that there's a third wave in the Free State province. But what's key here, Bradan, is that the province assists the elderly, especially those that don't have the means to actually get to vaccination sites or don't even know how to register. Many here, of course, are not tech savvy. Many of them don't have smartphones. And also many of them have children that are working and are unable to take a full day out to bring them to vaccination sites. So we do know that the Army has been deployed here to assist with registration. Red Cross has also been brought in. Paramedics have been brought in. So there's a lot of support staff to assist and go into the communities and help those to get here to the vaccination sites. Many of them have also been very reluctant to get the COVID-19 vaccine because of a lot of misinformation. And what the province is trying to do is to get them to come to the vaccination sites to see for themselves that all is in order. They provide soup and other means for them to make them feel as comfortable as possible. Let's listen to some interventions that the MEC identified.
What we do as the province, we use our community health care workers, and the Red Cross is also helping us with their volunteers. They go and do door-to-door in trying to assist the elders to register. Those that have not registered, we still welcome them here. Those that the walk-ins, we welcome them. We have created a station inside the tent, where they are helped to register on the EVDS, and then they get into the row to go and get their jab.
Well, we know that there's somebody was missing in the Free State this morning. He's on special leave. Yesterday, he was in the Northern Cape, as he would do when he goes around the country inspecting the rollout of the vaccines. He was supposed to be where you are in the Free State, but Dr. Mkhize is now on special leave. Did Metsi make any comments at all about the Health Minister's leave?
Yes, we do know that the Minister was, of course, in the Northern Cape yesterday, just before he was placed on special leave, and possibly because he was supposed to be in the Free State today, because this province is also in its third wave, and the Minister wanted to inspect some of the vaccination sites because some challenges have, of course, been identified. But, of course, the MEC for Health in the province saying that she truly hopes there will be no further disruptions when it comes to the vaccine rollout or any other issues identified within the health department now that Dr. Zweli Mkhize has been placed on special leave. Of course, there are concerns that there might be some kind of disruptions or delays, given the fact that there is now an acting health MEC, Mamaloko Kubane, but the MEC is saying that they do believe and hope that all will still be in order, and hopefully they will fast-track the Johnson & Johnson release of those vaccines from the Eastern Cape. So there's not much panic yet, but I do think that in the coming days it's going to be telling as to how fast or how quick we can get the vaccine rollouts and try and get those Johnson & Johnson vaccines released. We do know that the Minister did say yesterday that an additional thousands of vaccines have been secured from Johnson & Johnson Global to bridge the gap because of the over 3 million that have not been released from the Eastern Cape due to FDA needing to approve that. So hopefully, Bradan, will see an uptick in vaccine rollouts, not just here in the Free State, but nationally, as there's a desperate call to vaccinate as quickly as possible before the third wave hits the whole country.
Yeah, and with a little bit that's been available, at least I saw a health department statement earlier that saying more than 1 million, or just about 1 million senior citizens have already been vaccinated in the country, and we need that J&J to be released and approved by the FDA. And please, Heidi, you must take the advice from the nurse, Metsi, very seriously with the third wave there in the Free State. And take care, my dear. Be safe. Thank you very much. Heidi Jokos, they're talking to us from a vaccination site where they are registering the elderly in Bloemfontein in the Free State. And, of course, the Free State in the grips, one of the 4 provinces in the country that's confirmed officially to be in the grips of the third wave of coronavirus infections. Now,